Kidney transplantation. The kidney transplant is a surgery to place a healthy kidney from a living or decreased donor into a person whose kidneys no longer function properly. The kidneys are the two vein-shaped structure located on each side of the spine just below the rib cage. Each is about the size of a fist. Their main function is to filter and remove the waste, minerals and fluid from the blood by producing urine. When kidneys lose this filtering ability, harmful levels of the fluid and waste accumulation in the body, which can raise the blood pressure and result in the kidney failure. That is the end stage of the renal disease. The end stage renal disease occurs when the kidney have lost about 90% of the ability to function normally. This occurs when the kidneys have a diabetes, chronic uncontrolled high blood pressure, chronic glomerulonephritis, and that is the inflammation and the eventual scarring of the tiny filters within the kidneys. Polycystic kidney disease. People with the end-stage renal disease need to have the waste removed from the bloodstream via the machine, dialysis, or a kidney transplant to stay alive. Types. There are three different types like diseased donor kidney transplant, living donor kidney transplant, and the preemptive kidney transplant. Diseased donor kidney transplant. This is when a kidney from someone who has recently died is removed with consent of the family or from the donor cord and placed in a recipient whose kidneys have failed and no longer function properly and is in need of a kidney transplantation. The donated kidney is either stored on ice or connected to the machine that provides the oxygen and nutrients until the kidney is transplanted into the recipient. The donor and the recipient are often in the same geographic region as the transplant center to minimize the time the kidney is outside a human body. Second type is living donor kidney transplant procedure. This is when a kidney from a living donor is removed and placed into a recipient whose kidneys no longer function properly. Only one donated kidney is needed to replace the two failed kidney, which makes the living donor kidney transplant an alternative to deceased donor kidney transplant. A preemptive kidney transplant. This is the third type when you receive a kidney transplant before your kidney function deteriorates to the point of needing the dialysis to replace the normal filtering function of the kidney. Currently, most kidney transplants are performed on the people who are on the dialysis because their kidneys are no longer able to adequately clean the impurities from the blood. Why it is done? A kidney transplant is often the treatment of choice for the kidney failure compared with a lifetime on the dialysis. A kidney transplant can treat the chronic kidney disease or end-stage renal disease to help you feel better and live longer. Compared with dialysis, kidney transplant is associated with a better quality of life, lower risk of death, fewer dietary restrictions, lower treatment cost. Some people may also have the benefit from receiving a kidney transplant before needing to go on dialysis, a process known as a preemptive kidney transplant. But for certain people with kidney failure, a kidney transplant may be a riskier than the dialysis. Conditions that may prevent you from being eligible for the kidney transplant include advanced age, severe heart disease, active or recently treated cancer, dementia or poorly controlled mental illness, alcohol or the drug abuse, any other factor that could affect the ability to safely undergo the procedure and take the medications needed after the transplant to prevent the organ rejection. Only one donated kidney is needed to replace the two failed kidney, making the living donor kidney transplantation an option. If a compatible living donor isn't available, your name may be placed on the kidney transplant waiting list to receive a kidney from the deceased donor. How long you have to wait for the deceased donor organ depends on the degree of matching or the compatibility between you and the donor, time on the dialysis and on the transplant wait list, and expected survival post-transplant. Some people get a match within the several months and others may wait several years. Risks like kidney transplantation can treat the advanced kidney disease and the kidney failure, but the surgery isn't cure. Some forms of the kidney disease may return after the transplant. The health risks associated with the kidney transplant included those associated directly with the surgery and the rejection of the donor organ. Risks also include the side effects of taking the anti-rejection medication, immunosuppressant, and needed to prevent the kidney body from rejecting the donated kidney. Deciding whether a kidney transplant is right for you is a personal decision that deserves a careful thought and the consideration of the serious risk and the benefit. Talk through your decision with your family, friends, and other trusted advisors. Complications of the procedure. Kidney transplant surgery carries a risk of significant complication, including the blood clot and bleeding, leaking from a or blockage of the tube that links the kidney to the bladder, infection, failure or the rejection of the donated kidney, and infection or the cancer that can be passed on from the donated kidney, death, heart attack, and stroke. Anti-rejection medication side effects. After a kidney transplant, you will take a medication to help prevent your body from rejecting the donor kidney. This medication can cause a variety of side effects including the bone thinning and bone damage, diabetes, excessive hair growth or hair loss, high blood pressure, high cholesterol, and other side effects may include increased risk of cancer, particularly the skin cancer and the lymphoma, infection, puffiness, weight gain, and aching. Before the procedure finding a match, a kidney donor can be a living or deceased, related or unrelated to you. Your transplant team will consider the several factors when evaluating whether a donor kidney will be a good match for you. Test to determine whether a donated kidney may be suitable for you include blood typing. It is preferable to get a kidney from a donor whose blood type matches or it is compatible with your own. Transplants involving a donor and the recipient with incompatible blood type are also possible, but require the additional medical treatment before and after the transplant to reduce the risk of organ rejection. These are known as ABO incompatible kidney transplantation. Tissue typing. If your blood type is compatible, the next step is the tissue typing test called the human leukocyte antigen typing. This test compares the genetic markers that increases the likelihood the kidney transplantation. This will last a long time. A good match means it is less likely that your body will reject the organ. Cross match. The third and the final matching test involves mixing a small sample of your blood with the donor's blood in the lab. The test determines whether the antibodies in your blood will react against a specific antigen in the donor's blood. A negative cross match means they are compatible and your body isn't as likely to reject the donor kidney. Positive cross match kidney transplant, they are also possible but require the additional medical treatment before and after the transplant to reduce the risk of your antibodies. Additional factors your transplant team may consider in finding the most appropriate donor kidney for you include matching the age, kidney size, and the infection exposure. How do I prepare for the kidney transplant? To get a kidney from an organ donor who has died, you must be placed on the waiting list for the United Network for the Organ Sharing (UNOS). Extensive testing must be done before you can be placed on the transplantation list. A transplant team carries out the evaluation process for a kidney. The team includes a transplant surgeon, a transplant nephrologist, and one or more transplant nurses, a social worker, and the psychiatrist or the psychologist. Other team members may include the dietitian, chaplain, and anesthesiologist. The evaluation includes the mental health evaluation, psychological and the social issues involved in the organ transplantation such as stress, financial issues, and support by family and the significant others are assessed. These issues can greatly affect the outcome of a transplant. The same kind of the evaluation is done for a living donor. Blood tests, they are done to help find a good donor match, to check your priority on the donor list, and to help the chances that the donor organ will not be rejected. Diagnostic tests, they may be done to check your kidneys as well as your overall health status. This test may include the X-rays, ultrasound and the kidney biopsy and the dental exams. Women may get a pap test, gynecology evaluation and a mammogram. The transplant team will weigh all the facts from the interviews, your medical history, physical exam and the test to determine your eligibility for the kidney transplantation. Once you have been accepted as a transplant candidate, you will be placed on the UNOS list. When a donor organ becomes available, you will be notified and told to come to the hospital right away. If you are at get to a kidney from a living family member, the transplant may be done at the planned time. The donor must have the compatible blood type and be in the good health. A mental health check will be done to show the donor is comfortable with the decision. These steps will happen before the transplant. Your transplant team will explain the procedure to you and you can ask the questions. You will be asked to sign a consent form that gives you permission to the surgery. Read the form carefully and ask the question if something is not clear. If you have been on the routine dialysis before the procedure, you will get the dialysis before the procedure also. For a planned living transplant, you should fast for 8 hours before the operation, generally after the midnight. In the case of the cadaver organ transplant, you should start to fast once you are told a kidney has been available. You may get a sedative before the procedure to help you relax. Based on your medical condition, your transplant team may ask for the specific preparation. What happens during the kidney transplant? A kidney transplant requires a stay in a hospital. Procedures may vary depending on your condition and your healthcare provider practices. Generally, a kidney transplant follows this process like you will remove your clothing and put on a hospital gown. A intravenous IV line will be started in your arm or hand. More catheters may be put in your neck and breast to monitor the status of your heart and blood pressure and to take the blood samples. Other sites for the catheters include under the collarbone area and the groin blood vessels. If there is too much hair at the surgical site, it may be shaved off. A urinary catheter will be inserted into your blade. You will be positioned on the operating table lying on your back. Kidney transplant surgery will be done while you are asleep under the general anesthesia. A tube will be inserted through your mouth into your lungs. The tube will be attached to the ventilator that will breathe for you during the procedure. The anesthesiologist will closely watch your heart rate, blood pressure, breathing, and the blood oxygen level during the surgery. The skin over the surgical site will be cleansed with an antiseptic solution. The healthcare provider will make a long incision into the lower abdomen on each side. The healthcare provider will usually inspect the donor kidney before transplanting or implanting it. The donor kidney will be placed in the belly. Left donor kidney will be implanted on your right side. The right donor kidney will be implanted on your left side. This allows the ureter to be accessed easily for the connection to your bladder. The renal artery and vein of the donor kidney will be sewn into the external iliac artery and vein. After the artery and the vein are attached, the blood flow through these vessels will be checked for bleeding at the suture lines. The donor ureter, the tube that drains urine from the kidney, will be connected to your bladder. The incision will be closed with stitches or the surgical staples. A drain may be placed in the incision site to reduce the swelling. A sterile bandage or dressing will be applied. Talk with the healthcare provider about what you will go through during your kidney transplant. What happens after the kidney transplant? After the surgery, you will be taken for the recovery room. Once your blood pressure, pulse and breathing are stable and you are alert, you may be taken to the intensive care unit ICU for close monitoring. In time, you will be moved out of the ICU to the regular nursing unit as you recover and you are closing to going home. Kidney transplant usually calls for the several days in the hospital. A kidney from a living donor may start to make the urine right away. Urine production in a cadaver kidney may take the longer. You may need to continue the dialysis until the urine output is normal. You will have a catheter in your bladder to drain your urine. The amount of urine will be measured to check how the new kidney is working. Your team will closely watch how your anti-rejection medicines are working to make sure you are getting the best dose and the best combination of a medicine. Blood samples will be taken often to check the status of the new kidney, as well as the other body functions such as liver, lungs, and the blood system. You will slowly move from the liquid to more solid food as tolerated. Usually by the day after the procedure, you may start moving around. Benefits of kidney transplant. A successful kidney transplant gives you increased strength, stamina, and energy. After transplantation, you should be able to return to the more normal lifestyle and have the more control over your daily life. If you are dependent on the dialysis before the transplant, you will have more freedom because you won't be bound to your dialysis schedule. Anemia, a common problem with the kidney failure, might be corrected after the transplantation. Conclusion. If you have the chronic kidney disease or end-stage renal disease, a kidney transplant can eliminate the need for dialysis and give you a new lease on life. Before deciding on the treatment, be sure to discuss all of your opinions with your healthcare provider. You may also want to explore the additional resources provided by organizations like American Kidney Fund, National Kidney Foundation, Transplant Recipients International Organization. Staying knowledgeable can empower you and help you make well-informed decisions about your health. Thank you.